Hello dear friends and colleagues, I am Stanislav Chernonog, the author and creator of the online school of vector massage and somatics, and today we will talk about the extremely relevant topic. This is a pinched sciatic nerve. The fact is that this problem is extremely common. A huge number of people face it after the age of 30-40 years. It becomes massive and extremely relevant, and after the body passes approximately the middle of the life, and the body begins to collapse. If you have never had a pinched sciatic nerve, you have no idea how bad it is. People can't get out of bed, people can't get to the toilet, they get to the toilet on all fours, literally on their fours. In addition, it is extremely painful, it is extremely harmful to the health of the people it has happened to. And the worst thing is that modern medicine rather does not cure the problem, but only relieves the disease. Regarding this problem, I had people who lay at home without the opportunity to recover, get out of bed for months and even years. The problem is that the nerve is pinched. This nerve controls the legs. If the nerve is pinched, then the person cannot stand on the lower limbs. In addition to this, every attempt to stand up and move normally results in excruciating pain. Nevertheless, as part of the massage, we can quite effectively relieve the acute phase of pain at the time of pinching the sciatic nerve. Moreover, regular work on the correction of the causes that lead to sciatica can lead to a stable remission. In this video, be sure to watch it to the end. We will discuss what to do if the sciatic nerve is pinched right now, and I will also outline the strategy for what needs to be done so that this problem does not appear again or never appears in your life. In order to figure out how to treat this problem, we first have to understand the mechanisms of its occurrence with the help of the audience. And here we need to pay attention to how the sciatic nerves are actually arranged. If you look at the skeleton, you will find these yellow things. These are nerves. They are populated by the piriformis muscle. The piriformis muscle is a muscle that is attached along the back of the sacrum and along the greater trochanter of the femur. In the process of its passage, it can pinch the axis of the nerves that come out of the sacrum. Why does it happen? Because the joint between the sacrum and the ilium loses its stability. Why does the joint between these two bones lose stability? The fact is that it is normal and its natural state to stabilize the gluteus maximus muscle. And this muscle stops working, and as a result the piriformis muscle takes over the function. The piriformis muscle is much smaller in volume. In addition, it is much less adapted to stabilize the joint between the sacrum and the plantar bone, and therefore it enters into a state of spasm, and in this spasm it pinches the sciatic nerve. NAM breaks for a variety of reasons. I will name 5 main ones. Firstly, this is a problem with the psycho-emotional state, when a person runs incorrectly and shifts the intestines and pinches the sciatic nerve. In addition, there can be problems with the digestive system. When the intestines increase in volume, inflammation occurs, and the intestine pinches the sciatic nerve. In addition, it can be asymmetrical loads. Common problems with the gluteus maximus can also be that a person pinches their cervical spine, positioning their head in the wrong way when watching, for example, this video. In addition, a sedentary lifestyle, violations of the walking pattern may be one of the reasons why the gluteus maximus does not work. So the gluteus maximus muscle does not work, and this in turn leads to compensatory tension in the piriformis muscle, which leads to pinching of the sciatic nerve. The problem here, among other things, is that when the piriformis muscle is overly dormant and compresses the sciatic nerve, it causes it to also compress the nerves that control the gluteus maximus. Thus, the more tense the piriformis muscle, the worse the gluteus maximus muscle works. And the worse the gluteus maximus muscle works, the more the piriformis muscle tenses. Modern medicine proposes to get rid of this problem by injecting the anesthetic Novocaine into the piriformis muscle, which will cause the piriformis muscle to relax and thus the painful pinching of the sciatic nerve disappear, which in turn leads to the fact that the gluteus maximus does not work. But unfortunately, if the gluteus maximus does not work for any of the above reasons, then the person receives temporary relief, and after a while the problem returns even more strongly. Separately, I would like to say that problems with the gluteus maximus muscle in turn lead to the fact that a person during walking and at the moment of maintaining a vertical body position shifts the load from the gluteus maximus muscle to the square muscles of the lower back, which in turn leads to the volume of movement in the lumbar vertebrae here, in this region, increase significantly. Increased mobility in the lumbar spine leads to a higher likelihood of herniated discs in the lumbar spine. These hernias in turn pinch the nerves, which in turn leads to the fact that the gluteus maximus begins to work worse and there is a problem with pinching of the sciatic nerve. Thus, problems in the buttock begin to spread down through the pinched nerves and begin to spread upward through the formation of hernias in the lumbar spine. A curious thing about sciatica and problems in the lumbar spine is that when these problems occur, it is extremely bad for the appearance of your lower extremities. This leads to the fact that the venous outflow from the lower extremities is disturbed. This leads to the fact that the lymph nodes in the groin and along the inner surface of the thigh work worse. In addition, this leads to the fact that the lower extremities are much worse innervated and thus much less controlled by the central nervous system, which leads to a significant deterioration in appearance. This is swelling, this is the growth of subcutaneous fat deposits, this is a violation of the circulation of venous blood, varicose veins, the appearance of a vascular network. All this is due to the fact that a person is worse with the lower back. All this is due to the fact that the nerves are pinched and the blood supply is disturbed. The occurrence of edema, for example, may lead to the fact that the microcirculation through the capillaries will be disturbed, and thus the legs may have a significantly different shade and be cyanotic. This is due to the fact that a lot of lymph and fluid have stagnated under the skin, and this fluid does not allow blood to circulate normally through small capillaries. Thus, this problem is not only related to health and painful conditions at the time of pinching. In addition, on a regular basis, when this problem occurs, it leads to a significant deterioration in appearance and shape. In addition, it is extremely harmful to the pelvic organs. This is the entire genitourinary system in both men and women. So let me now give you practical tools at your disposal on how to relieve acute pain during a pinched sciatic nerve. I remind you that all the instructions that I offer you are of relative applicability, and in order to help people well, it is recommended that you still get a professional education and be confident in the results that you get. So the problem of pinching the sciatic nerve is primarily due to the fact that the piriformis muscle is shortened. The piriformis muscle is located from the greater trochanter of the femur to the sacrum. If we talk about how it is located in this direction, relatively speaking, across the buttocks. One of the main functions of the piriformis muscle is lateral, that is, external rotation of the thigh. This is when the knee goes to the outside. We can see this movement through bringing the bent knee of the median line towards itself. Thus, at the moment when we perform such a movement, the piriformis muscle is shortened. Our task is to stretch the piriformis muscle. So, we are doing a medial hip rotation movement. This is how we are doing the movement. It is very important that you perform this movement as carefully and slowly as possible, because the muscle is already shortened. Now this muscle is pressing on the nerve, and therefore at the moment when you begin to stretch it, it begins to put pressure on the sciatic nerve more. Therefore your task is to stretch it in such a way that it does not lead to a stronger compression of the sciatic nerve. We can accomplish this task by very slowly adducting the knee and lower leg outward. Your task is to move the lower leg outward several times while being in direct contact with the piriformis muscle itself. Right now I feel how my femur begins to rotate in the medial direction, and here I feel how the piriformis muscles are stretched. Repeat this movement several times with minimal amplitude, reaching the point of soreness and freezing at this point of soreness for a while. Ask your client to breathe while doing this movement. For example, here we have reached a certain threshold where there is further excessive pain, and we ask the person at this moment to take a few slow deep breaths and exhalations, and after the disease begins to decrease, we slightly increase the range of motion. There is also another way to relax the piriformis muscle. This is the so-called post-isometric relaxation. When at the moment when we adduct the leg in the external direction, we perform a medial rotation of the femur. We ask our patient, our client suffering from pinching, to apply light pressure in the internal direction. Now I'm asking my model to apply light pressure towards the middle. We count to 5 and then relax. We relax and find that the stretch range increases after that. This is due to the fact that the muscle fibers can be in a state of tension for about 5 to 7 seconds. Accordingly, at the moment when we massively tense all the muscle fibers inside the muscle for 5 seconds, they work for a while, then get tired, which allows us to perform a stronger relaxation. Stanislav, I have a question. How does this movement help to release the nerve? Does the muscle get smaller? How does this movement allow the nerve to be released from pinching? The fact is that we increase the length of the muscle, thus we lead to an increase in the space between the bone and the muscle and increase the space in which the nerve is located inside. In how many minutes will this exercise help me? This exercise will allow you to relieve tension in the gluteus maximus muscle in 5 to 10 minutes. Here I showed you an option when you perform a movement for your ward for your client. If the problem happened to you, then you can help yourself. I remind you that the main task is to perform a medial rotation of the thigh. You can take your foot behind the outside line and perform the movement by tensing your muscles, or you can help yourself to some extent with the help of your hand. Let's show. Here it is important to pay attention to the fact that very often, when there is a problem of pinching the sciatic nerve, there are problems in the lumbar spine. Therefore, this movement must be performed very carefully if you have problems with hernias. How the problems affect the state of health, we discussed how it affects the appearance, we discussed how the acute phase of the disease can be removed. Let's now talk about how we need to work in order to remove this problem in the future so that it does not appear again. I remind you that if you stretch the piriformis muscle, this will not solve the problem of the gluteus maximus. The problem may go away for a while, become not so acute and urgent, but you still need to treat the gluteus maximus. Here, in the case of our model, I can say with confidence that she has pain at the attachment points of the gluteus maximus muscle on one side, and here we see the problem more clearly. Thus, it is necessary to regularly work with the gluteus maximus muscle in places of attachment along the sacrum and along the ilium. There is a very important point here. I spoke about this many times, and I constantly come across the fact that people continue to put pressure on the exit side of the sciatic nerve. It is necessary to work precisely on the medial part of the gluteus maximus muscle. Let's take a closer look at the models. There is a sacrum about here, and approximately at this level is the place of attachment of the gluteus maximus muscle. A little lower, approximately in the middle of the buttock, is the exit of the sciatic nerve. This is where the piriformis muscle comes out. Accordingly, every time you start massaging the middle of the buttock, you thus begin to massage firstly the piriformis muscle and secondly start massaging the sciatic nerve. At the moment when we make an effort to massage the piriformis muscle, this leads to increased inflammation and increased pinching of the sciatic nerve. Please don't ever do that. Moreover, from my own experience, I can say that people constantly come who say, "It hurts here, please Stanislav, press harder here so that sparks fly from my eyes and probably this will make it easier." No, colleagues, it won't get easier. The middle of the buttock is a forbidden place to touch. You can touch the piriformis muscle and the sciatic nerve if you are very good at working with these places and know that doing this place is dangerous. We work with the places of attachment of the gluteus maximus muscle along the sacrum, along the cruciate mountain ligament, along the iliac bones, and wash all the triggers that arise in these places. It is also worth noting that if you want to solve the problem, you must work deeply with the sacroiliac joints, and you should definitely pay attention to the lumbar spine, because the instability of the lumbar spine can also cause this problem. In addition, I remind you that the rehabilitation of the gluteus maximus muscle should consist of two parts. First, we must massage the attachment points of the muscle itself. It would be very good if you figured out the root causes why the gluteus maximus does not work. Once again, this is the intestines and breathing and the psycho-emotional state and neck. We first ensure the functionality of the muscle, and then when the muscle is functional, we train it. If we first train the diseased problem muscle, then it will transfer the load to other replacement structures, which leads to increased pinching of the sciatic nerve. It is forbidden to exercise before you have treated the gluteus maximus muscle. Write in the comments your stories of how you had a sciatica. Tell us how painful it was on a scale of 10. Tell us how long the problem lasted and how effective the treatment was and what helped you to heal it in the end. And thank you for watching this video to the end. I will be grateful to everyone who writes a comment, likes this video, subscribes to the channel, because all this helps to promote the channel and makes this video more accessible to a wider audience. A huge number of people are struggling with this problem, a huge number of people are going the wrong way in terms of treatment, so every time you like or write comments, you help spread this video and help people. Well, as always, Stanislav Chernonog was with you, the author and creator of the online school of vector massage and somatics and the YouTube channel of the same name, where we learn to solve acute problems, learn to look into the root causes, and at the same time earn good money. Until we meet again, friends, goodbye.